My name is Dr. Daniel Fahim. I'm a brain and spine surgeon with Michigan Head and Spine Institute. I want to talk a little bit about the lumbar spine. It's a very common area of pain for many of my patients. And for a lot of the people in the United States, one of their most common health complaints is back pain. It's something we've all experienced, and most frequently it relates to muscle strain or muscle spasm or pulling a muscle, things like that. But sometimes it's related to disease within the lumbar spine that needs to be potentially addressed, possibly by a spine surgeon. Most commonly, the types of things that we need to do surgery for in the lumbar spine are ones where we have pain involving our lower extremities. Back pain itself very rarely requires surgery in very unique and rare circumstances. But pain in the legs, which is called radiculopathy and commonly called sciatica by many people, which sometimes is correct and sometimes is an incorrect term to use, but regardless, pain involving the lower extremity that comes from one of these lumbar nerve roots being squeezed because of a herniated disc or because of hypertrophy of one of the joints in the spine, that's what most commonly requires surgery, because we have to take pressure off of the area of the nerve. The nerves are what go to our legs and result in sensation and movement for our legs. And when we have pain or numbness in our leg, it's frequently because one of these nerves in the lumbar spine is being squeezed. Now, when that happens, there are several different things that could be wrong. One is that a disc may have herniated backwards, pushing against one of these nerves going to the legs, resulting in pain, numbness, or weakness. One of the other things that can happen is with age, these joints in our back, which are constantly strained every time we move, can become arthritic or hypertrophied, and those joints can kind of overgrow quite a bit, and that would also put a lot of pressure on these nerves as they come out of the spinal canal and go to our legs. Both of those reasons can be reasons why somebody might need surgery for the lumbar spine. Most frequently, when we need to have surgery on our lumbar spine, it's because of pain involving our legs, and that can be because of stenosis or narrowing of the spinal canal at multiple different levels, or narrowing of the neural foramen, which just means the window where the nerves come out. And whenever those nerves are being squeezed, we can get pain or numbness in our legs, which could require surgery. Most frequently, the type of surgery that we need for our lumbar spine is decompressive surgery. That just means a laminectomy or a discectomy, something to take the pressure off of those nerves. Rarely, on occasion, we need something more, which is a fusion. Sometimes when we remove the pressure off of the nerves, we're required to do a fusion to stabilize the spine. And that's only necessary usually if an extensive amount of decompression has to occur, and if a patient also has a substantial amount of back pain in addition to their lower extremity pain and numbness. Historically, those operations were performed in the old-fashioned way, where a large incision was made in the middle of the back. All of the muscles were removed off of the spine in both directions. The ligaments were cut, the bones were removed, and there was a substantial amount of destruction of the spine, which I believe predisposed patient to developing disease at other levels further on down the road, several years down the road. Nowadays, spine surgery should basically be done in minimally invasive ways whenever possible. That means using a minimally invasive incision that's usually off to one side, using a tube to access the spine to the specific spot that's causing a problem, taking the pressure off of the nerves with that minimally invasive approach, using a microscope to see exactly what we need to see after accessing the spine, and leaving all of the patient's normal ligaments and muscles and tissues intact. Those patients tend to recover a lot better after these minimally invasive surgeries. So we can do all these operations in the spine in a minimally invasive way. We can do laminectomies, discectomies, but even fusions can be done in a minimally invasive way. Discs can be removed and interbody grafts can be placed, the so-called transforaminal lumbar interbody fusion, sometimes called a TLIF. All of that can be done just with a tube with a small 3-centimeter incision that allows us to do the fusion, take the pressure off of those nerves, and get a patient feeling better. In fact, we can even put screws and rods into the back with a minimally invasive way without opening up the back in that old-fashioned way and causing a lot of destruction of the patient's normal tissues. Patients who undergo minimally invasive spine surgery recover faster, go to work sooner, stay in the hospital for a shorter period of time, lose less blood during surgery, and have better outcomes overall over the long term compared to patients who have old-fashioned open surgery on the spine.